Welcome back to Wave 3 Listens on an absolutely gorgeous day. Maybe you're thinking about a spring break vacation, maybe getting ready for summer. Let me remind you once again, Body Shapes Medical. If you want to lose a few lbs, we could all lose a few pounds. Lisa's with us once again, Lisa Innenbach. And Lisa, you have another very special guest.
We sure do.
And sometimes I think people wonder, okay, how fast will things take effect? How quickly will I see any type of results? I think that's a common question. Tell us Carrie's story, or Carrie, you tell us your story, whichever way you guys want to go.
Carrie is a great example. I'll let her tell her story. I'll just start you out with a little bit. She came to us about 13 days ago, and she's been able to take off almost 16 pounds in 10 days. 16 pounds in 10 days. Mm-hmm. All right, now already, Carrie, you're feeling some of the positive effects, right?
Oh, yes. More energy. I can breathe better. It's just been fabulous. I've just been really surprised at how easy it is to maintain the diet. I was really concerned about, changing my diet, but it's been easy. It's been painless, and it's been well worth it.
Well, I think you look fabulous. Some of the, I think everyone, when you're trying to lose weight, has goals. And Carrie, I'm curious, what are your goals when you approach Body Shapes Medical? What are some of your goals, maybe long-term and short-term?
I just feel like I want to get my life back. I've been sitting on the couch for too long, sedentary, and I'm just ready to get back out there. I've got a 13-year-old at home who's very active and wants to do fun things that I've, kind of held back on, and I want to be able to ride roller coasters and, do all the things that he wants to do and not have concerns about it. I'm just ready to get back out there.
Good. Those are realistic goals, and I think great goals. I think we're all pulling for you, Carrie, and obviously you're getting good results already.
Oh, yes.
So congratulations for making the decision to go to Body Shapes Medical. All right, Lisa, let's talk about the program a little bit more.
Sure.
We've talked a little bit about HCG. I want you to add on to that, and Exilus. But also there's a hormone component to this. It all works together. Can you talk about the whole teamwork thing here?
Yes, we offer hormone balancing as well. Hormone imbalance can trigger mental, physical, sexual problems in both men and women. So what we need to do is get the patients in there, get some lab work on them, and just look at the whole picture. I mean, again, we can take the weight off with our hormone with HCG, but we also would like to look at the whole picture of them, get them in the office, get their lab work, look at everything, and see what we can do from there.
And hormone levels are really, there are some red flags. So not only getting older as we get older and maybe lose production of hormones, certain hormones, but tell me, what are some of the red flags that people should look for? Like if they're saying, I'm feeling this, I'm feeling this, I'm feeling this, or the signs of maybe needing a little hormone therapy.
The signs and symptoms are just, there's so many out there. There's low energy, increase in belly fat, fatigue, anxiety, decreased concentration, headaches, wrinkling skin. I mean, a lot of women don't realize that they may need testosterone as well. If you think about it, if you lose testosterone as we get older, that's a loss of muscle mass. Well, if you lose muscle, even in your facial area, that can cause wrinkles. For men, I mean, again, increased energy. Depression can be one of those signs. Weight gain, muscle loss. So again, the first thing would be to come in and get your lab work done and see where you are as a baseline, and then we can figure out from there what you need and look at your symptoms as well. By the age 40, most of us don't have half of what we had at the age 25.
And we're not talking about unrealistic levels here. We want levels, like you said, as far as testosterone for the men. It'd be nice if I had the levels when I was in my 20s, and that can be done, right?
Absolutely.
And totally safely,
right.
as we mentioned before, very
bioidentical. Yes.
I think women are surprised when you think testosterone. It's always been associated with men.
Definitely.
Testosterone can help women as well, and I think it's okay to mention the fact libido. Right?
Oh, absolutely. That's one of the main concerns.
One of the benefits.
One of the benefits, for sure. I mean, our God-given hormones weren't made to last, as long as we're aging these days. We're living a lot longer, and our hormones just aren't keeping up with that. So that's where we step in and say, okay, let's look at what your hormones level were in 25, and you felt so good then. Now you're 40. Let's get those levels back to where they need to be.
And Carrie, I think anyone who is watching the show would say, wow, 16 pounds that quickly. And how many days was it again, Lisa?
10 days.
In 10 days. Okay, so
10.
is impressive. Is impressive. So first of all, congratulations to you. Secondly, have there been people who notice, whether your physical appearance or they notice your attitude has changed?
Oh yes. Oh yes. It's a confidence boost.
That's great.
I mean, who doesn't want to look more fabulous?
Sure. You're fabulous. We think you're fabulous.
Thank you. So yeah.
I can mention Carrie is single too, right?
That's
looking
right.
fabulous.
Thanks. Yeah.
But it's true. I mean, you can come off blood pressure medication, you can decrease your cholesterol medication, come off of your medication. We've had even diabetic patients that have been able to decrease their medication. Your confidence increases. And again, spring is almost here. It's in the air right now, so let's get in there and get you going.
Let's do it. Body Shapes Medical. I can't say it enough. And talk about the process. They call you. You mentioned blood work. And you mentioned an entire, really, a comprehensive program, right?
Right. The first step is to just give us a call. And I would like to point out the phones are really busy when we do the show, so please just leave a message. Someone will call you back within the hour. But you just want to make sure that you get in for the consults are absolutely free. So you have nothing to lose, obviously, but waiting when you come in. Just get that appointment. Let's get it done. And if you make an appointment today, you will get $100 off of your accelerated weight loss package.
All right. So I love that incentive to call Body Shapes Medical.
Absolutely.
All right, let's look here real quickly. I think we've got time to grab a phone call. Let's try Terry in Jeffersonville. Terry, welcome to the show. How are you, Terry?
Hi, how are you?
Well, you sound like you're loaded with energy. You have a question?
I do. You were talking about how the signs and symptoms are increased belly fat, loss of fatigue, sleep, things like this, hot flashes. I've had those symptoms for almost 10 years, and my MD keeps telling me that all of my hormone levels are good because I've had them checked, thinking I'm in menopause, something's going on because I put on 10 pounds in a week and we don't know why.
Sometimes we need to look at different hormones than your standard doctor will look at. We do full panels in our office. So the best thing to do without me looking at those labs and seeing exactly what we're talking about, I mean, some women are estrogen dominant, some women are progesterone dominant. We need to look at everything. And sometimes there are things that can mimic, it looks like your labs are normal, but they're not. So again, we can play with those things and we can definitely get you set up with some, different pellets or creams or whatnot, but I would definitely need to have you come in, look at your lab work, have the doctor do a physical exam, and then we can go from there.
There you go. Body Shapes Medical, medically supervised, safe weight loss, and also hormone therapy as well, should you need it. We'll be right back. More of your calls coming up on Wave 3 Listens.